arguably a reckless strategy. Number 4, we haven't put anywhere near enough controls on people or done enough tests from travellers from outside the United Kingdom from high-risk countries like Italy, China, America and Spain. We're simply giving them, we're not doing hardly any testing. We're simply giving them vague, wishy-washy advice to self-quarantine without forcing them into either a test, or if it's not practical that we cannot do the tests in a speedy manner, etc., then we are not forcing them into quarantine. We're not putting checks that they are doing that. But ultimately, we should have closed the borders and they shouldn't be coming from those countries currently. But any Brits returning from those countries should, without a test that says whether they're positive or negative, we should be forcing them into quarantine, and there should be stringent checks to ensure that they are doing that. Apparently, people are turning up from these countries at Heathrow, Manchester and so forth, and we are not putting any significant checks on them. They are simply leaving and they're advised to go into quarantine. That is ridiculous. Number 5, we haven't provided anywhere near enough protective equipment to frontline NHS workers. There's stories of doctors and nurses wearing bin bags and sharing face masks because because there's a complete shortage across the NHS of these products. Even though they've had 3 months to prepare, they knew that the virus was spreading. We had our first case over 2 months ago. They didn't procure anywhere near enough PPE, and so we have hospitals across the country with a dire lack of PPE. Some nurses are on the front line dealing with patients without even wearing a face mask. This is completely ridiculous. The World Health Organization has said that they should be in full protective gear with a full face shield. A face mask doesn't cover the eyes unless it's a full face shield. And so the virus can enter through the eyes, unfortunately. And so simply giving out more face masks is not just the answer. They need to be proper shields that will cover the full face. And there's no excuses when we had months to prepare. We could have either ordered shipments of PPE or we could have produced it ourselves. And unfortunately, it feels as though we haven't explored all procurement options to get PPE to our frontline workers, which is why you see some of them simply with a flimsy face mask, and some of them don't even have that. Some nurses have not even been using face masks, and that is completely ridiculous when we should be at all costs giving them the adequate protection. It seems like there's a complete lottery as to whether you can be tested. People in the NHS on the front line, even if they're claiming they have symptoms, are not being tested. If people ring it up 111, they don't get sent a test kit to confirm whether they have it because we have such a limited resources. Questions have to be asked about why we have such poor testing done in Britain, when obviously the testing would allow for accurate data and therefore an accurate response. But we're not testing anywhere near where we should be. There's an antigen test, not an antibody test. An antigen test, which obviously tests for the antigens, which would be apparent in the blood much faster than when the body makes antibodies against the virus. That antigen test can be done in 10 to 15 minutes. And I'm assuming that's what Korea have been using when they've been testing everyone who comes into the country and all people on the front line, and yet in Britain we're only just rolling out the antigen test, and they're only ordering 3.5 million. It's completely woeful. It really is. It's embarrassing. Why are all of